welcome to the briefing. Let me also welcome the European Commissioner for Crisis Management, Mr. Janice Linastic, and he will announce a multi-million-dollar EU humanitarian initiative in support of the COVID-19 vaccine rollout in Africa, as well as provide an update on Team Europe's support to Africa's response to COVID-19. We welcome you to the briefing, Commissioner. Colleagues, we are coming to you in English and in French. And after the briefings, we will have a very short question and answer session. So please have your questions ready. Today, we only have 30 minutes for the briefing. Please let me ask you to just ask one question per person so that we can accommodate as many colleagues as possible. As usual, you can use that WhatsApp number +251 502 310 +251 945 502 310. Alternatively, you can ask your questions live or write it down in our question and answer section. All right, now let me invite Dr. John Kangasang, the Director of the Africa CDC, for his brief. Dr. John, it's over to you.
Thank you so much. Welcome to our August guest, Commissioner of Humanitarian Affairs from the European Union. It's a pleasure to welcome you back to the African Union. The last time you were here, we were at the airport. I would like to reiterate our gratitude for the diagnostics that the European Union supported us with, which was extremely timely and extremely impactful. I will equate it to the discussion we are going to have today, which is on vaccines. At that time, the needs were on diagnostics and you stood by our side. This time, our needs are vaccines and you are here to support us. We are extremely grateful for that. On behalf of the chairperson of the African Union Commission, His Excellency Musa Faki Mohammed, who is following these activities, the progress of the concept of the whole of Africa approach to vaccinating its people to achieve 60% of the vaccines very, very closely. And we will not achieve this alone. We have to achieve this with our partners and what we are calling trusted partners. And the has been on our side all along. We have a partnership with the European CDC. We have been discussing with you all on how to support our strategy for vaccinating 60% of our population to achieve herd immunity. As we have discussed before, nobody is safe except we are all safe on the continent. And vaccine, as we recognize, is going to be the game changer in addition to their standard public health measures. So, Excellency, welcome to the African CDC. You are one of our trusted partners and we look forward to working with you very closely. Winnie, please, I think you are muted.
All right, thank you very much, Dr. John. Now we go over to Mr. Janice Linastic, and he is the European Commissioner for Crisis Management. Excellency, we welcome you to the briefing and you have the floor.
Thank you very much. Good morning to everyone. It's a great pleasure to be here, and I'd like to start by thanking Dr. Kangasang for his warm hospitality today here at the headquarters of the African Union Commission. I would also like to congratulate him for his recent renewal of the mandate as director of the African CDC. I think that this is a testimony to his leadership over these years. European Union supports a global approach to this pandemic. As you said, Dr. Kangasang, nobody is safe until everybody is safe. That's why we need to tackle this pandemic globally. And the European Union is trying to do just that. And most recently, President von der Leyen, President of the European Commission von der Leyen, announced the 100 million euro funding for the rollout of COVID-19 vaccination campaigns in Africa. This is a humanitarian funding. It's dedicated to support the members of the member states of the African Union in preparing and rollout of their vaccination campaign. This comes on top of European Union's support to the COVAX facility. European Union, together with its member states, is one of the largest, if not the largest, contributor to the COVAX facility, to the amount of now 2.5 billion euro almost, that the European Union and member states have contributed to this facility, which, as we know, is devoted to ensuring vaccines for 92 low and middle income countries, many of them in Africa. And I'm really happy to see that COVAX has been delivering millions and millions of doses also to Africa in the last couple of months. I would also like to point out the fact that the European Union now is the biggest exporter of vaccines. It exports almost as much as it uses within European Union. This is also another aspect of European Union's solidarity and of its global approach that I mentioned, because we have to win this battle globally, or we won't win it. So it's a great pleasure that today we can announce this 100 million humanitarian initiative in support of vaccination campaigns here. This will be done in a very close cooperation with Africa CDC. And I really am grateful to Dr. Kangasang for his active promotion of this aspect, the support to rollout of the vaccination campaign, because it's not only vaccines that you need, you also need the infrastructure, personnel, and equipment to roll out the vaccination campaigns. And this is precisely what we would like to address with this funding. And we are looking forward to very close cooperation with African CDC in this respect. This is part of our bigger, wider partnership between European Union and the African Union. It is also one further step in strengthening our partnership with African CDC in particular. African CDC, although it came into existence only recently, has already become a very strong partner of ours. And with this new additional humanitarian program, I think I'm confident our partnership will be further strengthened. Our goal is to continue to work closely, hand in hand, during this pandemic and beyond. Thank you.
Thank you very much. That was Mr. Janice Linastic, the European Commissioner for Crisis Management, joining Dr. John Kangasang of the Africa CDC in this special briefing for today. So Dr. John, perhaps as we just wait for our colleagues to bring in their questions, you might want to give us some detail about how this funding is going to support the efforts of the Africa CDC on behalf of the African continent to combat the ongoing COVID-19 pandemic.
we will be able to use this support that Commissioner Linastic just mentioned to support our continental strategy of immunizing up to 60% of our population. As you rightly said, the 100 million is not to acquire vaccines. We will acquire vaccines through the African Vaccine Acquisition Task Team, AVAC, and we also acquire vaccines through COVAX, which Commissioner Linastic mentioned. But then once you get the vaccines here, how do we roll that out into people's arms? So this is where the 100 million will be very, very instrumental in supporting member states directly. I mean, the 100 million is not coming to Africa CDC, but it's going directly to the country. So it will be very supportive of the vaccination process there. So we are very grateful for that. It also speaks to the unified approach that we are preaching. We are saying to our partners that we have an instrument, which is the public health instrument of the continent, the Africa CDC, which is the equivalent of the European CDC. And that if you want to see measurable success with impact, you channel this support in coordination and collaboration with Africa CDC, which is really a strong underpinning of our continental joint strategy, which hinges on the ability to cooperate, to collaborate, to coordinate, and to communicate. So, I mean, this effort today ties in very well with that cooperation and collaboration component of our joint strategy.
Thank you very much. I think colleagues are still trying to write down their questions, so perhaps let me pose a question to His Excellency. Excellency, I would want to find out what mutual lessons are there in terms of this fight to combat the pandemic. What mutual lessons can you share from the EU side, and what have you learned from the African side, since this is really a new disease that everyone is still trying to come to grips with?
Thank you very much for this question. The key lesson that we have learned and that everybody should have learned from the beginning of this pandemic is that we have to cooperate. We have to work together with each other. We have to make this quest a global one. And yet, you know, we see countries that say, well, first we will vaccinate ourselves, and then maybe there will be opportunity for others. European Union is not like that. European Union is exporting at the same time that it is vaccinating its population. As I said, almost half of what is produced in Europe is exported to the rest of the world, including through COVAX facility. But I particularly like this idea that Dr. Kangasang came first out with, that we need not only to take care of vaccines, but also of the vaccination campaigns. And that's how we tried to tailor this humanitarian initiative that we are now today presenting to you, because there will be two key tracks. But what is common to both is that we will build on synergies between the expertise of African CDC on one hand, the humanitarian partners of ours who are implementing the projects on the ground, and national health authorities, because this program will have two tracks. One is with the national authorities to strengthen their ability to roll out and conduct vaccination campaigns, and the other track is for humanitarian settings. We should not forget that these are humanitarian funds. And humanitarian settings are especially delicate area because they're hard to reach, because they are often neglected, because people in humanitarian settings, refugees, internally displaced persons and others, are not always included in national vaccination campaigns. So we also will add this track so that nobody is left behind. Thank you.
Thank you very much. Let me come to Dr. John. We have a question that's coming from Paul Adepoju, who is working with the Lancet. And Paul wants to find out if there is a breakdown of how much will go to the respective African countries, considering the differences in the specific vaccine types that African countries are rolling out.
So, Paul, these are not, again, as the commissioners indicated and myself, these are not, the 100 million is not to get vaccines and distribute to countries. It's to facilitate countries to set up what I call vaccination centers and the rollout mechanism. So the breakdown of exactly how much will go to each country is not an issue that we can put on the table now. It will be based on their strategic plans. The commissioner rightly mentioned that we are not going to set up a parallel program. It's going to be in support of the country vaccination plans, and all countries have developed their plans. So once you engage these countries, we'll look at the interface between our discussions with them and where they are with their vaccination plans and what needs they have. So there will be a process, an iterative process, until we know exactly what the needs are. So it is, the easiest thing would be to say, well, we get 100 million euro and then you buy the vaccination needs commodities, auxiliaries, and just distribute it equally by 55 member states. That will not help. I mean, that will not lead to a program impact. Some countries are capable and very capable of doing their own things. They may not need this kind of support. Some countries will need tremendous support to get to where they have to be. And then the specificity of this program is very important. The humanitarian component of that, which you just heard from Commissioner Linastic, is extremely valuable because it has to be tailored to meet those the goals of the targeted nature of the funds. So we'll keep you updated, Paul, as always, as we know more and with engagement with the countries. The beauty of this, and I really like you to take this message home, is that it is a collaboration with the European Union on the one side and Africa CDC. Africa CDC will be following up this very, very closely. There will be partners other than Africa CDC that will be supporting the rollout of this, like the UNICEF and other partners in countries, but they will keep us informed. We will be monitoring what is going on in the countries, and we'll, of course, be sharing that information in a more public way.
Thank you very much, Dr. John. Let's take a question from Judith Akolo, who is working for the Kenya Broadcasting Corporation. And Judith says, every time an EU member state has raised queries over the AstraZeneca, there has been apprehension among African states that got their supplies of AstraZeneca via the COVAX facility. What is the EU doing to reassure Africa that indeed AstraZeneca is as good as any other vaccine used against COVID-19? Perhaps let me start by just giving that to you, Dr. John, and then we'll move on to the Commissioner. The part of the question that you might answer is, how can you reassure Africa that AstraZeneca is as good as any other vaccine that is being used against COVID-19?
Yeah, thank you, Judith, for your contribution. Let me say that all vaccines that have been have received the emergency authorization used by the WHO and from us are very safe and very efficacious. Now, any medication that you take has a risk associated with it, okay? And for those of us that take, say, drugs on anti-hypertensive drugs every day, each of that little pill that you take and you swallow has about 14 side effects that you are putting in your mind. But so it's you, the individual, to weigh it out and say, okay, am I ready to die of a stroke or have attack, or I live with 14 side effects, dizziness, and or leading up to slowness of your heart rate and whatever. So anything you take has a risk. Okay, any medication, and take it from me, I mean, for 30 years of experience in public health. Let me now quantify the risk of the vaccines that you are receiving. AstraZeneca vaccine, clearly the data is showing that if you vaccinate 1 million people, 4 people may come up with a blood clot. Okay, that represents a risk ratio of 0.0003%. Now, if you are a woman and you take contraceptive pills, about 500 to 1,000 women will develop a blood clot. And that represents a risk of about 0.01. So the risk is even several fold higher than receiving your AstraZeneca or the Johnson & Johnson vaccine. If you smoke, if you run out there in a little corner and you light a cigarette and you smoke, 1,700 people will be at risk. If 1 million people smoke, 1,700 people will be at risk of developing a blood clot. That becomes a risk of about 0.2%. So if you do nothing, you get your COVID vaccine, you get your COVID virus infection, 165,000 people will die out of every 1 million infected. So that becomes a risk of about, you can calculate that about 2-point-something%. So that is what you mean by risk. You have to shift that and say, where am I comfortable with? Am I comfortable with being 4 out of 1 million people that may develop a blood clot, or I want to live with a virus where if you're infected, you have a chance of about 2% or more to die. So that is what we are looking at here. So let me just end by saying there's absolutely no drug. When you go home today, do a simple thing, take aspirin, and go to the back, the label, and you see where it's written contraindication. You see the risk that you are taking by taking that aspirin that helps reduce your fever or help reduce your pain. So that is the way we should be looking at these vaccines.
Thank you very much for that. As we are zooming back to the EU Commissioner, let me just repeat the question for His Excellency. And that question coming from Judith, the part that pertains to the EU is, she says, what is the EU doing to reassure Africa that indeed AstraZeneca is as good as any other vaccine that is being used against COVID-19?
Thank you for this question, and I really cannot add much to what Dr. Kangasang already explained, in such a great detail and convincing detail, I have to say. Well, European Union is trying to do the same. We are advocating a scientific approach based on facts and data like the one that was just presented by Dr. Kangasang, that compares risks of aspirin and other things with the very low risk of AstraZeneca. Now, how to convince? Well, you're right. There are some states that have restricted or even abandoned AstraZeneca, but they are very few. The large majority of EU member states continue to use AstraZeneca. And if it can help, I can only say that even though I cannot choose which vaccine I will be vaccinated with when it is my turn, I will take any vaccine, including AstraZeneca myself, if that would help anybody. But I think that the data that has been presented by Dr. John and is also being presented by the European Union and European Medicine Agency is self-explanatory. It speaks for itself. When I mentioned the European Medicines Agency, I would like to say that this agency has conducted a thorough examination of all the vaccines before it authorized their use. When the blood clots appeared, and then when there appeared to be a link with the vaccine, the European Medicines Agency again looked into the matter and concluded that benefits of AstraZeneca far outweigh the risk involved. And these benefits were explained with the figures. You run a much greater risk, thousands of times of greater risk. If you don't take AstraZeneca, you get sick with COVID than if you take AstraZeneca. So I think that we should stick to the scientific approach. The risks are known. There is a risk, but it's very minor, especially compared with some other behaviors that we continue to indulge in, and that I hope people will not go for unreasonable approaches here, and trust the science, and the science is very clear. I repeat, benefits of AstraZeneca far outweigh the risks involved.
Thank you very much, Mr. Linastic. Judith Akolo has come back with another question, and she says this one is aimed at Dr. John. And she says, with COVID-19, a lot of pharmaceuticals and vaccines are now coming into Africa. What are we doing to ensure that the medical waste being generated so far does not actually turn into another pandemic?
It's a very good question, and be assured that there are problems that we have anticipated, and we call that infection prevention control. And there are problems that we will encounter that we were not even thinking of it. And I mean, as you encountered and solve any problems, other problems would arise. And I think what you just highlighted is one of those things that fall under the umbrella of infection prevention and control, how well we dispose of anything that we have used and dispose of it properly. So that is all part of good public health practice in the countries. And we will, as the vaccines come in and they are immunized, we will be providing guidelines on how to even dispose of those, the empty bottle vials that have been used appropriately, so that it doesn't lend itself for reuse or for other things there. So, but that is a very good question and reflection from you.
Thank you very much, Dr. John. I think we are now at our 30 minutes mark, which is what we were allocated for this press briefing. So can we zoom into the EU Commissioner for his closing remarks? So, Excellency, Mr. Janice Linastic, the European Commissioner for Crisis Management, please give us your final comments, those headline points that you want our journalists to take away from this briefing.
I will be repetitive a little bit because some of the key points were already mentioned, and I think they are very important. First key point is pandemic is a global challenge. We will have to defeat it on a global scale, or it won't be defeated. Second, European Union has demonstrated its solidarity in many respects with regard to this pandemic, including through its financial contribution to the COVAX facility and through exports of vaccines produced in the European Union. And third point is we will go beyond this. And I'm really glad that we found such a qualified and expert partner in African CDC, that together we will be able to assist members of the African Union in rolling out their vaccination campaigns. This is part of what we see as a global approach, which is necessary in this situation. Thank you.
Thank you very much. Let's move on to Dr. John, and he is the director of the Africa Centers for Disease Control and Prevention, the Africa CDC. This has been a big day, and an announcement has been made of a multi-million-dollar support package. What are your final comments that you want the journalists listening in today to take away from this briefing? Dr. John, your microphone.
Yeah, let me transmit the sincere appreciation of Chairperson Faki, Excellency Musa Faki, the Chair of the African Union Commission, to this partnership. I mean, you all know, those who have followed the Commission, that this is a top priority. This meaning the ability to fight COVID-19 on the continent is a priority number one for Chairperson Faki. And I think he has always expressed the need for us to collaborate, to cooperate, and to coordinate our efforts across, because he recognizes that this is truly a global pandemic, means all people together. So I think that is it. I think the Commissioner Linastic has mentioned here, and I'll state it otherwise, that if we want to go further, we go together. I mean, if you want to go quickly, you go alone, but we will not be able to solve this pandemic if we take the lonely path. So the European Union is here to say that we hear you. As a continent, we want to work together with you so that we can go further. We just don't know how where this pandemic will take us to, but we know that if we work together and roll out vaccinations, it will be a game changer in our ability to win the war against this pandemic. So we are going to go together with the European Union so that we go further. Thank you.
Thank you very much, Dr. John. That message of going together, chiming very well with what the commissioner has said about this being a global pandemic and that we have no choice but to work together in order to defeat it. So, colleagues, thank you very much for having joined us. This was a very short, special press briefing that was put together jointly by the European Union and the African Union. From the EU side, we had Mr. Janice Linastic, and he is the European Commissioner for Crisis Management. And from the African Union side, we had the Director of the Africa CDC, Dr. John Kangasang. Well, that's it for today. We have our usual press briefing on Thursday at 11 a.m. East African time. So join us then. For now, bye-bye and thank you.